Hi friends, today let's talk about a very important topic, that is neck triangles and neck fascia. Now, neck is a very important topic, and this presentation will help a lot to all the practicing head and neck surgeons, neurosurgeons, and ENT specialists, and even for the students. So I'll try to cover each and every um, clinical clinical points relevant to the exams and for the practicing purposes. So as we know, neck is a very important part of our body. A lot of neurovascular vascular structures pass through it. So uh, let's go through the topic and let's discuss each point. Now, as we know, before going deep into the structures of the neck, let's first talk about our very superficial layer uh, in the neck. That would be our skin. So about skin in the neck. So as we know, we can see here horizontal lines. These are our Langer's lines. So these are very important because um, it is they keep the neck skin in the tension. And why is it important? Because as we can see, these are the horizontal lines placed in the neck, and here in the occipital region they are vertical. So but in the neck they are horizontally placed. So whenever we do our skin incision in the neck, the ideal um, incision would be horizontal or parallel to these Langer's lines, um, or we can call them tension lines also. And these are the transverse lines. So this incision usually should be placed uh, parallelly or horizontally in the line, because that will help us to heal properly, and won't be any scars visible. So there would be invisible scars if we do our incision. So this is very important point. um, or if we talk about the skin of the uh, neck region, yeah. So we can easily appreciate the lines are Langer's lines are horizontally placed. So a question can be asked. Sorry. So question can be asked, placement, how the Langer's line in the neck region placed. So we can see they are all horizontally placed. So our skin incision also should be horizontal. One point done. Now, another point about the head and neck region, skin would be, we can see here now cervical segments, um, the cutaneous nerves, and supplying our head and neck region. So if we are particularly talking about the head and neck region, so here we can see we have C2 cervical segment, C2 cervical nerves, C3 area, C4 area. Yeah, so all supplied by uh, from C2 till C4. Yeah, cervical nerves. So important point here is very easily it can be remembered. Above the C2, C1. Why not C1? C1 is not placed over here because, as we know, C1 doesn't give any branch. Yeah, C1 doesn't have any branch, so we can easily exclude it. Then why not C5 over here? Because C5 till T1, as we know, gives the roots, trunks, and everything for the brachial plexus. Yeah, it supplies our upper limb. So brachial plexus is from C5 to T1. So therefore, it's very easy to remember. We won't talk about C5. Why not C1? Because C1 doesn't have any, uh, doesn't give any branches uh, to any cutaneous branch to supply. Yeah, so very easy to remember. Therefore, we must always remember segment would be C2 till C4. Yeah, C2, C3, C4. So here we can see C5. Some area over here, the deltoid and everywhere, this region would be C5, but we are talking about C5 to T1. T1, as we know, it would be your brachial plexus. Yeah. Then here below the C4, it would be all your T2. Yeah, all it would be your T2 cervical T2 segment. Yeah. T2 T2 spinal segment. So 2 points important 2 points, very crucial important points have been covered here. One is about regarding your Langer's lines. Yeah. Second would be uh, cutaneous, the dermatomes over here in this region. So our dermatome in this region, in the neck area and the um, side of the neck area, would be from your C2 till C4. Yeah. C1, as I already mentioned, doesn't give any cutaneous branches, so therefore uh, we won't think about C1. And above C2 it would be your trigeminal. Yeah. Above C2 it would be, this all area would be your trigeminal, covering your face. So it would be your trigeminal 1, trigeminal 2, trigeminal 3. Yeah. So ophthalmic, maxillary, and mandibular. So above C2 it would be your trigeminal, and below C4 it would be your T2. All right. So this point is all clear, yeah? So about the dermatome in this area would be C2, C3, C4. Of course, we will talk about the cutaneous branches like your lesser occipital and greater auricular, lesser auricular nerve, all right. All those things, lesser occipital nerve, sorry, and greater auricular nerves, and third occipital nerve, which we will cover in the coming slides. So these 2 points should be very clear. C2 till C4, and above C2 it would be your trigeminal area. Below C4 it would be your T2. C5 till T1 is excluded because that is your brachial plexus. Yeah, so very easy to remember. Let's go to the next slide. Now, after covering the skin, below skin we have superficial fascia. Yeah, so superficial fascia is basically it has the aureolar tissue. So here we can see we have the superficial fascia, and here we can see the muscle. Now this is a very thin, broad muscle in the neck, anterior neck, and the side of our neck region. So this muscle is platysmal muscle. So as we know, the platysmal muscle is itself is a part of your superficial fascia. Yeah, it covers from um, it is coming from your pectoralis major fascia, and continuing above and going towards your mandibular area. Yeah, so it has a broad base over here, platysma muscle. It is a very thin muscle, and do remember, so it is a part of our superficial fascia in the neck. Yeah. So skin we have covered. Below skin we have the superficial fascia, which is a broad muscle, very thin muscle in the anterior and the side of the neck area, in the neck. Then over there we can see we have the external jugular vein. Now external jugular vein is also a part of our superficial vein, which is a part of the superficial fascia, which itself is in a superficial fascia. So here we have the external jugular vein. All right. So we have covered in the superficial fascia. We are supposed to know we have the platysma muscle, we have the external jugular vein muscle, external jugular vein (EJV). So these are the few points of the superficial fascia. And after that, of course, below superficial fascia, we will have deep fascia, which we will discuss in detail. Now, again, about here we have the uh, superficial cutaneous skin, and referring to here we can see, as I already mentioned, we have C2, C3, C4 area. Below here it will be your C5, and anterior region it will be all your T2. C5 till T1, as I already mentioned, brachial plexus would be part of your brachial plexus supplying your upper limb. Here it is your C2, here it is your C3, here it is your C4. All right. Rest, here we can see trigeminal area, ophthalmic branch of the trigeminal nerve covering this area. Yeah. Then V2 over here and V3 over here, which is your mandibular nerve of trigeminal, mandibular branch of trigeminal, that is V3, or trigeminal. Yeah. And mandibular, and this is your maxillary, and this is your ophthalmic. Ophthalmic and maxillary both are your sensory. Only the V3, that is your mandibular part of your trigeminal nerve, that is V3, is your mixed, that is sensory and your motor as well. Motor supplying the muscles of your mastication. So C2, C3, C4 need to be remembered. Not, you shouldn't confuse this because it's very, very important here. So above C2, as I already mentioned, it would be your trigeminal, and below C4, it would be all your T4. Yeah, T2. Sorry, T2. Yeah. So C1, as I already mentioned, C1 won't be included because C1 doesn't give any branch. So easy to remember. Why not C1? Because C1 doesn't give any branch. Why not C5? Because C5 is a part of your brachial plexus. So hence, therefore, below C4, everything would be your T2. Now again, same thing, talking about our facial dermatome. As already mentioned, C2, C3, C4. Here it is your C2. Now C2 over here is your greater occipital nerve. Now difference over here is, uh, if we talk about C2, C3, C4, neck is divided into the side, in the lateral part, that is side of the neck, and the back of the neck. So back of the neck we have greater occipital nerve. We have the greater occipital nerve, then we have lesser occipital nerve, and then we have cutaneous branches from C4 and C5. Yeah, so these are your cutaneous branches from C4, C5, greater and lesser occipital nerve. So question can be asked: back of the neck and occipital area, a part of occipital cranial part, is covered by which nerves? So in that case, we need to know greater occipital nerve has the dorsal rami from your C2, dorsal rami, and lesser occipital nerve is from your C2 and C3 level. Yeah, and here we have the cutaneous branches from C4 as well as C5. But remember, this is the back of the neck. Yeah, don't you confuse this back of the neck with the side of the neck. Side of the neck would be your greater auricular nerve, which we will discuss further in upcoming slides. So greater auricular nerve is giving side of the neck. Yeah, it's in the side of the neck, whereas same with the anterior cutaneous nerve of the neck are supplying this area. So remember, in the back of the neck, the root value would be from your dorsal rami. It would be from your dorsal rami, whereas on the side of the neck would be from your anterior rami. Yeah, anterior rootlets of your anterior rami. So that's the difference. Here it would be dorsal rami, and here would be nerves coming from your uh, anterior rami, yeah, of this specific level. So for this area, for let's say it is C2 and C3, we are talking about C2 and C3, which part, whether anterior or whether dorsal. Of course, we are talking about anterior. If we are talking about anterior cutaneous nerve of the neck, this area that is coming from the segment of C2 and C3 spinal nerves, but we are talking about anterior rami. If we are talking about lesser occipital nerve. Yeah, if we are talking about the lesser occipital nerve, it would be dorsal rami. Coming from dorsal rami, greater occipital nerve also would be coming from your dorsal rami, and C4 and C5 cutaneous branches over here would also come from your dorsal rami of these particular segments. Supraclavicular nerve, it's over here. It is a part of your, since as we can see, it is on the side of the neck. Therefore, it would come from your anterior rami of C3 and C4. Overall, what we can to summarize, back of the neck, back of the neck, we have four nerves: greater occipital nerve coming from C2, lesser occipital nerve coming from C2 and C3, and C4, where here we have cutaneous branch of C4, and sometimes we can include cutaneous branch of C5. So back of the neck, dorsal rami; side of the neck, anterior rami. So anterior rami would be from here. We can see great auricular nerve on this area coming from C2 and C3 segment, And anterior cutaneous nerve of the neck, C2 and C3 segments, and supraclavicular nerve, C3 and C4 segment, also would be from anterior MI, since these are on the side of the neck. Yeah. So this is very important. Now, greater auricular nerve, this area is very important for a clinical point of view, and for the exam purposes, one must remember. Now, this GAN, yeah, great auricular nerve, is the one. Suppose a question is being asked, angle of the mandible is supplied by which nerve? So we must know angle of the mandible is supplied by great auricular nerve. Yeah. So angle of the this area, yeah, would be supplied by your um, great auricular nerve. Yeah. All right. Now lesser occipital nerve over here we can see is supplying your retroauricular area. Yeah, all right. So question about the great auricular nerve is it supplies the angle of your mandible. So as I have already talked, back of the neck and side of the neck. Side of the neck, we are talking about the anterior rami. Back of the neck, we are talking about the dorsal rami. And here we have the four nerves. Here we have the four nerves. Yeah, we will further talk about them in the upcoming slides. So here again we can see this is slide illustrating, demonstrating. Here we have. Let's talk about the side of the neck. Now, side of the neck, as we can see, we have four cutaneous branches coming out. Yeah. So four cutaneous branches. One is your this one, lesser occipital nerve. Now, lesser occipital nerve ascending, is ascending and in the retroauricular area. Yeah, it is supplying the retroauricular area. Then we have greater auricular nerve. Here we have the greater auricular nerve. As I already mentioned, greater auricular nerve would be supplying your angle of the mandible. So this point should be remembered. Greater auricular nerve. Then again on the side of the neck, we can see another nerve, which is called your transverse cervical nerve. Now this transverse cervical nerve will supply your anterior region of the neck. Then one again a trunk of three nerves is coming out in the side of the neck. Here we can see, and this is your supraclavicular nerves. So here it is a trunk, and from that trunk, we have for the three division, we are getting three nerves. One is your lateral one is your intermediate one, and one is your medial one. So these all are your supraclavicular nerves. Again, they are coming from C3 and C4 levels. Overall, one thing must be remembered is our if we are talking about the cutaneous branches of all this area in the head and neck region, in particularly in this area, we will talk about from C2 till C4. Yeah, just from till C4. Forget everything else. Yeah, forget C1, forget T1. All right, forget C5 till T1 because C5 till T1 is a part of your brachial plexus, as I already mentioned. So it's very easy to remember. I've seen for students it's very confusing, this part, but I'll try to make it simple. Just remember, uh, just just divide the part of the neck, head into two regions. One is the back area, and one is the side of the neck. Back of the neck and side of the neck. If we are talking about the side of the neck, we are talking about four cutaneous nerves. Yeah, four cutaneous nerves, and those four cutaneous nerves, of course, would have just spinal segment from C2 till C4. Yeah, so just remember C2 till C4. So here we can see side of the neck, lesser occipital nerve, C2. All right, one nerve covered from the side of the neck. Another nerve, greater auricular nerve, of course, we have to think about just from C2 till C4. So it would come from your C2 and C3. Two nerves covered. Then another nerve on in the side of the neck, we have the transverse cervical nerve. Here we have again, we can give from C2 and C3. And fourth nerve, which we must talk about when we are talking about the side of the neck, would be your supraclavicular nerve. Now, supraclavicular nerve itself is divided into lateral, intermediate, and medial. Now lateral will supply your, now these all will descend, and here we have your clavicular. Yeah, so here we have clavicular. So just imagine this is our clavicular. So lateral would supply your lateral part, one third of your clavicle. Intermediate will supply middle part of your clavicle, whereas medial supraclavicular nerve would supply your one third medial part. Yeah, so we must divide clavicle into three parts: medial, intermediate, and lateral. Yeah, so lateral would supply the most lateral part, medial would supply the most medial part, one third, and intermediate would supply the middle one third of the clavicular area. All right, and these all three nerves are coming anterior to your clavicle. Yeah, so this is the point to be remembered. Then, as I now we have talked about our four cutaneous nerves in the side of the neck area. Yeah, lateral, one, two, three, and four. Lesser occipital nerve, greater auricular nerve, transverse cervical, and supraclavicular. Lesser occipital nerve is supplying your cranial part of your auricular area. Yeah, and part of your cranial part and your retroauricular area would be supplied by this area would be supplied by our lesser occipital nerve. Now great auricular nerve will supply your angle of the mandible mainly. Transverse cervical nerve will supply your skin of the anterior neck region, and lateral, intermediate, and medial supraclavicular nerves. These will supply your area of the clavicular area. Yeah, and but remember, these all are cutaneous branches. Therefore, they will just innervate the skin. Yeah, we are just talking about the cutaneous branches, and we will further talk about them in which triangle they are, which triangle, which part of the triangle this is. So this part is basically your occipital triangle in the posterior triangle. Yeah, it is the part of your occipital triangle in the posterior triangle, which we will further read in detail. So side of the neck covered. Then we talk about the back of the neck. Now, in the back of the neck, we can see again few other cutaneous branches. Yeah, these one are different from these one. Here we can see in the cutaneous branches, here we have the vertex. Now, vertex is the most superior part of our head, of our cranium. Yeah, most topmost part. So that is your vertex. But in the back of the area, back region of the neck, we must remember we have the greater occipital nerve. Yeah, we have the greater occipital nerve. So greater occipital nerve is also from C2. Lesser occipital nerve is also from C2. But remember, greater occipital nerve is for the back of the head, back of the neck, whereas lesser occipital nerve is for the part of the, as already mentioned, part of the side of the neck. Then we have again third occipital nerve. Third occipital, easy to remember. It is from your C3 segment. It is coming here in the this area. Yeah, another two branches, another two nerves would be your C4 and C5 cutaneous branches of your C4 segment and your C5 segments. All right, so overall we need to remember eight muscles. Yeah, we need to remember eight nerves, four for your side of the neck and four for your back of the neck. For back of the neck, we must remember we have the greater occipital nerve, we have third occipital nerve, and we have C4 and C5 cutaneous branches of the uh, C4 and C5 segments, yeah, cutaneous branches. So eight cutaneous branches we have read. So let's go and we will further talk about them in the upcoming slides. Now, um, as already mentioned, in the superficial fascia, we have these cutaneous branches. We haven't finished our superficial. Still, we are in the superficial. We have covered our skin. In the superficial fascia, I talked about the platysma. I talked about the superficial veins in this region. Now, superficial veins would be your external jugular vein, for example. Then In the superficial fascia itself, there would be your cutaneous branches, which we have talked about in detail. So here is the cutaneous branches in this region. Cutaneous branches, four in the side of the neck and four in the back of the neck. Then here we have external jugular vein. As we can see, external jugular vein. Here is your ear, and here we have the retromandibular vein coming down, and here we have the postauricular vein. Now, postauricular vein and the retromandibular vein, they both join and they give your external jugular vein. So, external jugular vein, again, it's a part of your superficial fascia. Yeah, everything, this would be part of our superficial fascia. Like they would be superficial to your deep fascia. So that's why I've included this slide, so one must be familiar. So retromandibular vein drains, post auricular vein drains, they both join and make your external jugular vein, and external jugular vein drains into your subclavian vein. Yeah. So here is your subclavian vein. So one must know external jugular vein is a superficial, very superficial structure. Yeah. It can be easily seen, uh, especially when we can see, we have seen many times in the when the right atrium pressure is increased or the patient is lying down. So in those cases, we can see they are distended. Yeah, so it can be seen. So external, again, another question can be asked: external jugular vein is formed by which two other veins? So external jugular vein is formed by combination of by when the retromandibular vein and your posterior auricular vein are joined, they make external jugular vein. Now again, about the retromandibular vein, it's a very very important point regarding your parotid gland. Yeah, so parotid gland over here, and these are all the structures which are related to your when you're doing the surgery on parotid gland. So your facial nerve and your retromandibular vein are very important structures related to your parotid gland. I won't go into the detail which are superficial and which are deep structures, but in another topic I will talk about especially the parotid gland. So it would be very important at that time when we will discuss about the retromandibular vein especially. It's a very very important point one must know, but as we know, it's linked to your parotid gland as well as your facial nerve. So that's why we when we do superficial parodactymy, so in that case it's very important. Now again, another superficial vein in the neck region is your anterior jugular vein over here. Anterior jugular vein coming and draining into external jugular vein. All right. So anterior jugular vein is a structure, is a vessel, is a vein, superficial vein, which is in the anterior side of your neck, present in the anterior area of your neck. All right. So anterior jugular vein, one must remember, it's in the anterior area and it drains into your external jugular vein and finally draining into your subclavian vein. So till now we have covered skin, we have covered superficial fascia, and we have covered superficial veins. Superficial veins, sorry. So superficial veins, we have covered about external jugular veins, anterior jugular veins. Now after covering our skin and superficial fascia, platysmal muscle, cutaneous branches on the side of the neck and in the back of the neck, and the superficial veins that are those are our external jugular vein and your anterior jugular vein. Now we reach to a much deeper structure, that is our deep neck fascia. Yeah, so let's talk about deep neck fascia, which is a bit complicated, but let's try to make it simple. Now As we have till now, we know superficial fascia was very easy to understand. It's not that much complicated. Now, deep neck fascia, it's a umbrella term, which itself has different layers of itself. So here we can see one part. Uh, Deep neck fascia is divided into your investing fascia. It is also divided into pre-tracheal fascia, and it is divided into pre-vertebral fascia. So these three are the main fascias which are part of the deep neck fascia. But overall, there are around 9 and 10 uh, fascia of the deep neck. Yeah, deep neck fascia is further divided into around 9 or 10. But here in this picture, of course, we will discuss each one of them. But in this picture, we can easily the main ones would be your investing fascia, your pretracheal fascia, and your prevertebral fascia. Now, investing fascia, as we can see, as we can understand by the name, investing is investing each and every structure in the neck area. So here we can see, here is your skin and your superficial fascia, this one. Over here we can see this one is your investing fascia. Now, investing fascia would be a fascia which is like a collar. Yeah, it's covering your neck from anterior to posterior and from lateral. Yeah, it's covering everything in your neck, just like your skin. Just like the skin, investing fascia, investing fascia, which is a part of your deep neck fascia, is covering your neck from all sides. Yeah. So again, a quick recap. We have in the anterior region, we have the skin. Then we have the platysma muscle, which is not shown here. Platysma skin. We have the platysma muscle. Platysma muscle. Remember, it's in the anterior region of the neck, anterior and lateral region of the neck. It's not present anywhere else. Yeah. And then we have the superficial veins. Those would be your external jugular vein and anterior jugular vein would be somewhere here. Anterior jugular vein, which we'll further talk about them. Then we have deep neck fascia. Then deep neck fascia is further divided into many fascias. One of them is the main one is your investing fascia, which is covering everything in your neck like this. So let's talk about the investing fascia first. Here we can see we have the investing fascia, investing deep fascia or investing fascia of the neck, you can say. So investing fascia, see in the anterior region, it's over here. Here we have the SCM, yeah, sternocleidomastoid muscle over here on laterally placed uh, on the side of the neck. Very, very important muscle for the on when we are talking about neck anatomy, because all the neck triangles and everything which we will read in the upcoming slides is based on these muscles, yeah, placed laterally, both bilaterally. Yeah, this is your SCM, sternocleidomastoid muscle. Now, in what investing fascia does is it is investing. It divides into two layers. One is one over here and one over here, anterior and posterior, and it covers your SCM. Yeah, it covers and it invests your sternocleidomastoid muscle. Here again, we can see one coming in this way and one coming on this side, anterior and posteriorly. It envelops your sternocleidomastoid muscle. This one, yeah. Long muscle. Now, SCM is a long muscle coming from your mastoid process and giving your two clavicular heads and uh, to sternal head and your clavicular head. There, its origin is in the clavicular area and then the sternum area, and it is inserts into the mastoid process in the towards your mastoid process. So its origin and insertion is from bottom to top. All right. Now coming back to your investing fascia covering your SCM. Then again here we can see all this is your investing fascia. Now in the back region of the head, in the shoulder area, we can see in the neck area we have the trapezius muscle on both sides. Now investing fascia again, what it does is it covers these trapezius muscles. It covers these both trapezius muscles, and this is all. what we know about investing fascia. Yeah. Other than these, invest. Sorry. Other than these, investing fascia would cover your parotid gland. The same way it envelops your SCM, sternocleidomastoid muscle, same way what it would do is it would envelop your parotid gland also by giving two layers, which we will discuss in the further in the upcoming slide. So, what we can remember about the neck investing fascia is uh, it's a fascia which covers all of your neck from all its borders from anterior to posterior and both sides laterally like a circle. It's covering all your neck like a circle, just like the skin. And it covers two muscles. One is this one, and one is this one. This is your sternocleidomastoid, and one is your trapezius muscles. And for the clinical point, again, a question can be asked: what are the two glands which investing fascia envelopes? So we know about the two muscles. Two muscles which investing fascia covers is your SCM, sternocleidomastoid, and your trapezius. And two glands which it would cover would be your parotid gland and your submandibular gland. Yeah. So very important question. What are the two glands which investing fascia envelopes? So investing fascia would envelope your parotid gland, same way, dividing into two structures which we'll talk about: submandibular gland and your parotid gland, and plus two muscles, this one and this one. All right. So this is all about investing fascia. Then we have pre-tracheal fascia. Now, as the name suggests, it's pre-trachea is before is in front of the trachea, so that's why it's pre-tracheal fascia. Again, it's also a part of your deep neck fascia. Now, here we can see this area. We have the this is the pre-tracheal fascia. Here we have the trachea in front anteriorly, and here we have the esophagus placed posteriorly. Now, pretracheal fascia covers your trachea from like this, from in front and in laterally, bilaterally. This is your pretracheal fascia. Now, pretracheal fascia and investing fascia, of course, they will in this area they would unite somehow. Not shown clearly in this picture. I will show in an upcoming slide. They get joined also together. So pretracheal fascia again is a part of your deep neck fascia, and it's in front of your trachea, yeah, and bilaterally over here. This one, this is your trachea, and this is your all your pretracheal fascia, like this, coming like this, like this, like this, like this. All right. When we will talk about the pretracheal fascia in more detail in upcoming slide, it will be much more easier for you to understand. Then let's talk about the third fascia, the main one also. So as I mentioned, we have around 10 or 11 of deep neck fascias. That out of these 10 or 11, the main one are your investing fascia, pretracheal fascia, and prevertebral fascia. Rest are all the condensation of these of any one of these. Yeah, either investing, either pretracheal or prevertebral fascia. They get united, they get condensed, and hence names are they're giving subdivisions. Yeah. So all right. So prevertebral fascia we can see over here in the brown one. So prevertebral fascia, as the name suggests, is before, just the same way it was pretracheal fascia, which was in front of the trachea. Prevertebral fascia is in front of your vertebrae. Yeah. So here we can see a vertebra. Here we can see C5 body. So prevertebral fascia is over here, and it 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 covers all your prevertebral muscles. Yeah. So here we can see uh, scalenus muscles, yeah, anterior, medius, and posterior somewhere here. So these all are your prevertebral muscles, yeah. So all are prevertebral muscles over here. Then is covering your prevertebral muscles as well as all your scalenus anterior, scalenus medius, and for all your muscles, yeah, in the thoracic area. So here we can see. So everything is covered like this by the prevertebral fascia. Now, what prevertebral fascia does when it goes towards the posterior region of the back in the neck, it gets united with the investing layer which was over here. So prevertebral fascia and deep fascia, they both get united somewhere in the back area. All right. So not that much complicated. Prevertebral fascia, it covers the prevertebral muscles and all the back muscles, yeah, spine muscles. So it's giving a kind of a roof to all the back muscles in the neck area. All right. So let's talk about each one of them in further detail. Now, in this diagram, we can see we have the cross section of the neck. Here we can see um, the thyroid gland, and here we have the trachea, and here we have the esophagus over here. Now, superficial fascia. Before superficial fascia, as we know, we have the skin. We already talked about the skin. Then we have the superficial cervical fascia, which is also called as subcutaneous tissue. Just the difference is there's not that much fat and everything in this area. So it's superficial cervical fascia, which has platysma muscle over here. It will have platysma muscle. It would have your superficial veins, like your external jugular vein and your anterior jugular vein. Then it would have your cutaneous nerves, like already mentioned, eight of them, four in the side of the neck, four in the back of the neck. Then superficial cervical fascia is this one, covered. All right. So all these fascias basically till investing layer, everything is covering your neck in a circular motion, like a collar. Then deep cervical fascia, as already mentioned, deep cervical fascia is divided into three main ones. One is your um, anterior, one is your investing layer, one is your pretracheal fascia, and one is your prevertebral fascia. The use of these deep cervical fascia is it divides your neck area into three compartments. Yeah, one would be your anterior compartment, one is your posterior compartment, and two bilaterally are your neurovascular compartments. All right, so this is the main role: anterior compartment. Then this is your visceral compartment, you can say anterior compartment or visceral compartment. Why? Because we have the thyroid gland, we have the trachea over here, so all the important structures, larynx, pharynx, all right, esophagus, everything. So this is your visceral compartment. Now visceral compartment is divided by is separated by other compartments through your pretracheal fascia. All right, so that's why it's pretracheal is your visceral compartment. Then we have prevertebral compartment, that is your prevertebral fascia, which is dividing the neck area into your muscular area, yeah, which is your um, prevertebral fascia, dividing your neck into your posterior compartment over here. So in this slide, as we can see, we have carotid sheath, which we will talk about. It's again a part of a different fascia. All right. So here we can see superficial layer of deep cervical fascia. Here we can see, here is your investing layer, the most outer layer, surrounding your sternocleidomastoid. And here in the back area, it's covering your trapezius muscle. Yeah. All right. Here we have the prevertebral fascia, which is coming like this. Prevertebral fascia. This one is the investing layer. Investing layer, it has superficial part, deep part. Here we have the prevertebral fascia coming like this over here, going towards your backside. So here, as we can see, it's written superficial layer of deep cervical fascia. Superficial layer, deep cervical fascia, superficial layer. That is, we are talking about the investing fascia over here. Investing fascia is covering your two muscles. One is your sternocleidomastoid, one is your trapezius muscle, and it it will cover your submandibular gland and parotid gland also, which will give for the submandibular fascia, which we will discuss in later part. Again, in this image, we can see this is the anterior view cross section over here. We have your trachea, we have your esophagus, we have your thyroid gland. This one is your pretracheal fascia over here, like this. Pretracheal fascia. Here we can see your investing layer covering everything like this. Investing layer of deep fascia, pretracheal fascia of deep fascia. Then we have the pre-vertebral fascia of deep fascia. Yeah. And then we have here, we can see we have the carotid sheath, which is also a part of your deep cervical fascia. All right. So as we can see here, we can see the layers of deep cervical fascia would be your investing layer like this, covering everything like a collar. Pre-vertebral layer in front of your spine, in front of your vertebra over here. So this all like this. This area is your pre-vertebral fascia, covering all the spine muscles. Then we have the carotid sheath placed bilaterally in the neck over here, enclosing very, very important structures, neurovascular bundles, your uh, common carotid artery, your internal jugular vein, your vagus nerve, everything enclosed in this carotid sheath. So to get inside and um, to reach any of these structures in the neck, we must make an incision in the carotid sheath. Yeah, all right. And here we have the pretracheal fascia, part of your deep fascia. And fourth one is your investing layer of your deep fascia. So deep fascia is basically divided into four main ones: investing layer, prevertebral layer, carotid sheath, pretracheal layer. All right. So this is your deep cervical fascia. Again, same image, cross section. Here we have the your thyroid gland, trachea, esophagus, carotid sheath with your common carotid artery, or your internal carotid artery with your internal jugular vein and vagus nerve placed in the posterior side. Again, the carotid sheath. Internal carotid artery is the most medial one, and internal jugular vein is your most lateral one, and your vagus nerve is placed between them. All right. Then we have ansa cervicalis in the anterior side of the carotid sheath, and sympathetic chain would be in the posterior part of your carotid sheath. All right. And this is your spine, this is your green area, this one is your prevertebral fascia. Investing fascia over here, we can see investing fascia covering your sternocleidomastoid muscle here, and here it is again, your investing fascia. Then again dividing into two and enclosing your trapezius muscle. And here we have the pre-tracheal fascia. All right. Now here we can see in pre-tracheal fascia over here, and here we can see the carotid sheath. And here we can see in this picture image platysmal muscle. Remember, platysmal muscle over here is the part of your uh, superficial fascia, and here we can see the skin. So we have skin, we have the superficial fascia, including your platysma and your superficial veins and superficial lymph nodes. Then after that we have the deep fascia, and then here we have the deep fascia, here we have the investing layer of deep fascia. All right. So skin, superficial fascia, and then we have the investing layer of deep fascia. Now let's talk about each one of them in bit of detail. Now, few important clinical points for the exam purposes. Here we have the pretracheal fascia. Remember, as already mentioned, pretracheal fascia covers everything in the neck like a collar, but other than that, it covers also. Uh, uh, Sorry, it was investing layer which covers everything in your neck like a collar. But right now we are talking about the pretracheal fascia. Here is the pretracheal fascia. This one. So pretracheal fascia, what it does is its upper attachment is to the your hyoid bone. Upper attachment. It's attached to your hyoid bone, and here it is, investing layer. Now this pretracheal fascia. Now pretracheal fascia. What it does is it covers your thyroid gland. It envelops your thyroid gland from both sides. Like here we can see this is your pretracheal fascia covering your thyroid gland, like everything, like everything is covered. Thyroid gland is covered in your pretracheal fascia, giving it a capsule, false capsule. So basically, it's not a capsule of thyroid gland itself, but pretracheal fascia covers it like a capsule, hence makes a capsule around thyroid gland. So here we have the thyroid gland and pretracheal fascia covering, enveloping your thyroid gland, and further continuing down and continuing with the fibrous pericardium. Yeah, pericardium and continues with your pericardium. All right, the outer layer. So this is your pretracheal fascia. All right. Another important point of what is ligament of Berry. The ligament of Berry is the attachment of posterior part of your pretracheal fascia, posterior part of your pretracheal fascia, which connects your pretracheal fascia posteriorly with the cricoid cartilage. Yeah, all right. So this is very important. So ligament of Berry, all right, is very important. It gives a attachment of the thyroid gland with the cricoid cartilage. So that's why when we swallow or uh, when we eat food, and therefore that's why it moves. Yeah, uh, because of this berry, ligament of Berry, because it is attached. All right, so that's the reason. Here we have the thyroid cartilage. Here we have the cricoid cartilage. So remember, again, another question can be asked. Ligament of Berry is the connection of investing layer or with the thyroid gland, at whether it's with the thyroid cartilage or whether it's with the cricoid cartilage. Remember, the point to be noted is cricoid cartilage. All right. So this is pretracheal fascia. Pretracheal fascia divides into two layers, anterior, posterior, and covering your thyroid gland, continuing with your fibrous pericardium. Upper attachment of the pretracheal fascia is with the hyoid bone, and lower attachment is with the fibrous pericardium. Now let's talk about the carotid sheath. Carotid sheath, as already mentioned, is bilaterally in the both side of the neck, enveloping very very important structures, neurovascular structures. Here we can see cranial nerve 10. Then in medially we have your sorry, laterally we have your internal jugular vein, and medially we have your common carotid artery, dividing, bifurcating into your internal jugular and your external jugular vein. External jugular vein, further we can see giving terminal branches, your maxillary and your superficial temporal artery over here. So important structures about the carotid sheath are three. One must be remembered for all the exams purposes: internal jugular vein, vagus nerve in the middle and posterior, and then common carotid or the bifurcated part, that is internal carotid artery. Remember, external jugular vein is not the part of your carotid sheath. All right. Then let's talk about the prevertebral fascia. So we have talked about the pretracheal fascia, we have talked about the carotid fascia, then let's talk about the prevertebral fascia. Now, prevertebral fascia, as we can see, uh, here we can see in this area, prevertebral layer, yes, this one. So this one is your prevertebral fascia over here. The important point about the prevertebral fascia is it covers everything. It covers all the spine muscles. Yeah, all the spine muscles. So it divides, it separates your in the neck area. If we are particularly talking about in the neck area, now prevertebral fascia um, is separated from your this pharyngeal fascia. This one is your buccopharyngeal fascia, and this one is your prevertebral fascia. Now, between prevertebral fascia and the buccopharyngeal fascia, there would be a space. Yeah, here we have the space formed. That is the retropharyngeal space. So, as we know, retropharyngeal space is the common site for inflamed lymph nodes and the abscess formed in the retropharyngeal space, so which we will further talk about in detail. So remember, this is your prevertebral fascia, prevertebral layer. All right. So prevertebral layer, in front of the prevertebral layer, we must know we have the retropharyngeal space separated by the pharynx. Here we have the pharynx, pharyngeal muscles. So pharyngeal muscles has the buccopharyngeal fascia, and behind the buccopharyngeal fascia and in front of the pretracheal fascia, pre-vertebral fascia, sorry, we have the retropharyngeal space over here. Very important point, because infection, lymph node inflammations can happen in this area. This image also in illustrating, we can see here we have your pretracheal fascia. Here we have the thyroid gland. As already mentioned, as we already talked about, pretracheal fascia is covering, enveloping your thyroid gland and coming down and getting joined with your uh, pericardium, fibrous pericardium. Above, pretracheal fascia goes and joins your hyoid bone over here, as we can see. All right. So hope this point is clear about your prevertebral fascia, pretracheal fascia. Pretracheal fascia, remember, it's enveloping your isthmus gland. Importance of prevertebral fascia is it separates your retropharyngeal space. Yeah, it's separating pharynx from your spinal area, or giving that space, which is very important. So we will talk about buccopharyngeal fascia in further upcoming slide. Then let's talk about investing layer and the parotid fascia. Now, investing layer, as I already mentioned, important point is you can remember it by two things, two, two, two. Why is it so? Because it covers two muscles. Two muscles are your sternocleidomastoid muscle and your trapezius muscle, and it envelopes your two glands also. So one gland is your submandibular gland, and one gland it covers, it envelopes, is your parotid gland. So again, here we can see investing layer. Investing layer, as we know, is a part of deep cervical fascia. It gives your superficial layer, it gives your deep layer, and therefore enveloping your parotid gland. Yeah, here we can see it's a lateral view. So we can say sagittal view. So here is your parotid gland, and investing layer is giving two layers. One is your superficial layer, one is your deep layer. Superficial layer is also known as peridomesenteric muscle fascia, because it's going towards your masseter muscle, and here we have the deep layer. All right, going towards your EM, external acoustic meatus, on that side, hence covering your parotid gland. So, and again, investing layer also covers your submandibular gland. Here we can see hyoid bone, and here we have the angle of the body of the mandible, and investing therefore covering your mandibular gland, submandibular gland, from both sides. So, important point of investing layer would be, for the exam purposes, covers two muscles. Those are your SCM, sternocleidomastoid muscle, and your trapezius, and covers, envelopes two glands. Those are your parotid gland, and one is your submandibular gland. All right. Now we have pharyngobasilar fascia. Um, till now we have covered the main three deep fascias have been covered. One is your investing fascia of the deep fascia. Then is your pretracheal fascia of deep fascia. Then we have prevertebral fascia of deep fascia. These have been covered. Now, few important points for the exam purposes about subdivisions of further subdivision of your deep fascia. Another deep fascia would be your pharyngobasilar fascia, yeah, in the neck region, and buccopharyngeal fascia. Let's cover both of them in this slide. Now, important point of these are, here we have lumen, here we have the pharynx, yeah, in the neck, all their pharyngeal muscles and everything. Buccopharyngeal muscle fascia. What it does is it covers this constrictor muscles, all the constrictor muscles of the pharynx from outside, whereas pharyngobasilar fascia is the one which covers all the constrictor muscles, or the constrictor muscle from the inside. Simple point. So here we can see, here we have the muscle. So buccopharyngeal muscle would be outside these muscles. It would be the most outer part, whereas pharyngobasilar part would be inside, inner part. All right. So this is very important. And buccopharyngeal fascia, as you remember, I already talked about. Um, it would be separated by your prevertebral fascia by a retropharyngeal space. All right. So here we have buccopharyngeal fascia. Here we have the pharyngobasilar fascia. For the exam purposes, remember pharyngobasilar fascia is the one covering inside of the pharynx, inside inner layer of the pharynx. Buccopharyngeal fascia would be covering the outer part. That is also your buccinator muscle, yeah, outer part of your pharynx. All right, and here it would be somewhere, of course, if it is the outer part, here would be retropharyngeal space. Yeah, so retropharyngeal space would be related to at the posterior. It would be posterior to your buccopharyngeal fascia. All right. Here we can see we have the constrictor muscles. All right. So here we have the pharynx, lumen. Then we have the pharyngobasilar inner part, inner side. Outer part would be your buccopharyngeal part, fascia. Yeah, covering outside. Yeah, of your pharyngeal muscles. Here we can see again illustrating much more simpler diagram. Here we can see vertebra. Here we have pre-vertebral fascia covering all the spine, covering all the spinal muscles over here. Pre-vertebral muscles, everything is covered. Then coming more anteriorly, because this is the back side. Yeah, this is the back part, posterior part. Then in front of the prevertebral fascia, we have some lymph nodes. As we already talked about, these lymph nodes are in the retropharyngeal space. So this is all your retropharyngeal space in the neck. Yeah, these lymph nodes can get inflamed. Abscess can be formed here. Yeah, retropharyngeal abscess. Yeah, everything can be formed in this area. Therefore, boundaries of retropharyngeal space would be in the posteriorly it would be your prevertebral fascia, and anteriorly it would be your your prevertebral, sorry, your buccopharyngeal fascia. Here we can see buccopharyngeal fascia. All right, and here we have the pharynx, pharyngeal muscles, pharynx constrictors. All right, and this is your lumen. Here the food passes. All right, so this is the most anterior part here over here. This one is posteriorly. So this is in the neck area. This is your buccopharyngeal fascia. Here it would be your pharyngo, fascia. This one, pharyngobasilar fascia. All right, this one, this one over here, this one, like this. This one would be here, your pharyngobasilar. This one, pharyngobasilar, and outer part here would be your buccopharyngeal fascia. All right. In this diagram, yes, we can see here we have the skull base over here. Then we have the constrictor muscles over here. Yeah, this is your esophagus, pharynx, and your esophagus continuation. So here, here we have the buccopharyngeal fascia. Then, of course, behind buccopharyngeal fascia, we have the this is space. This is your This is your retropharyngeal space. Then we have here your pretracheal fascia in front of your vertebral column. Here we can see. So this is your prevertebral fascia. Then anterior to prevertebral fascia, we have this space called retropharyngeal space. Then in front of that, we have buccopharyngeal fascia, this one over here. All right. Then we have here the pharynx, and on this side somewhere it would be your um, pharyngobuccinator fascia. Yeah. All right. Then again, ligamentum nuchae is also a part of your deep fascia, deep cervical fascia. It's important. Here we have the superior nuchal line over here. Here we have the external tuberance of the occipital area over here. All right. So here we have the superior nuchal line. So your ligamentum nuchae is the continuation of your all the supraspinatus, supraspinous, and intraspinous muscles. They are continuing above as a ligamentum nuchae. It's a midline structure. This one is it's on the back side of your neck. Yeah. So this is also a part of your deep fascia if we are talking about the neck. All right. So here this insertion somewhere would be in the superior nuchal line. Yeah, external occipital tuberance. External occipital tuberance over here. It would be here. All right. So ligament 9 is a midline structure, a tough one. It's a continuation of your supraspinatus muscles, ligament, sorry. All right. Then we have another last one, I guess. Sorry. The last one would be your suprapleural membrane, which is also known as your Simpson's fascia. Now, important point for the exam purposes would be suprapleural membrane. It's a part somewhere, a structure which can be seen on the apical area of the lungs, yeah, apex of the lungs only. It's uh, insertion over here we can see in the transverse process over here of the C7, and it continues down till your first rib, yeah. So covering your apex of the anterior part of your apex, yeah, anterior part of your apex. Here is the apex, here is the cervical pleura, so it's in front of the cervical pleura. But point to be noted is just in the apex, in the apical area of the lungs. All right, and in front is a very important point. In front of that, we have the subclavian artery and subclavian vein. So subclavian artery and subclavian vein are separated by the apex of the lung via through your Simpson's fascia. Yeah, very clinical point and very important point related to the exams. So subclavian arteries, subclavian vessels are separated by the apex of the lung through your Simpson's fascia, and attachment of the Simpson fascia is from your C7 transverse vertebra, C7, remember, and till your first rib. Now this diagram is illustrating, here we are your first rib, here we are the sternum, all right, and here we can see your Simpson's fascia or suprapleural membrane is coming from your transverse process and coming down, and in the on the inner part, on the inner boundary of your first rib is getting inserted over here, and here somewhere would be your apex of the lung. All right, and your vessels, your subclavian vessels would be here somewhere. All right, but imagining your clavicle coming like this. So subclavian vessels would be separated by your um, apex of the lung through your Simpson's fascia and your uh, parietal pleura. All right. Again, here we can see we have the lungs. Here we have the clavicula. We can see below clavicula, and here we have the first rib. Here it would be first rib. Yeah, this boundary is of your first rib. Your Simpson's fascia is coming from your C7 cervical vertebra and getting inserted in this area. And C7 vertebra can be very easily palpated when you flex the neck. Then you can easily imagine, you can easily palpate your C7 cervical vertebra spinous process. So you can imagine from there till your apex or first rib is your suprapleural membrane. So Simpson's pleura insertion and origin would be, remember, C7 transverse process and first rib. All right. Now we are finished with around 10 of the deep fascia, 10 or 11 deep fascias, and we have completed our superficial fascia. We have completed the skin. So now let's talk about the neck triangles. So let's very quickly go through them. Now in this diagram, as we can see, we have the neck of the we have the side of the neck. We can see now this muscle, as we can appreciate this muscle over here. This one is your suprasternal notch. This one is your suprasternal notch. Here we have the clavicle. Now this muscle over here is getting from your mastoid process over here. Sternocleidomastoid. Why sternocleido? It has two heads. One is your sterno head, that is your going towards your sternum, and one is your clido, getting one head is on the clavicle, yeah, most medial part of the clavicle. So that's why it has two heads, sternal head and clido head, that is your clavicular head. That's why sternocleidomastoid. Here we have behind the ear, we have here we have the mastoid process. All right. Very easily, it can be palpated. If you put your index finger behind your ear lobule, so here somewhere it's your mastoid process. So its insertion, origin of this sternocleidomastoid would be at this area, at the somewhere around the supraesternal notch, and at the clavicular head and the sternal head, and its insertion would be at the mastoid process. Hence, here we can see we have the sternocleidomastoid muscle. Importance of this sternocleidomastoid muscles is because it is the one which will divide our neck into your anterior triangle, and behind it it will form posterior triangle. So anything in front of the sternocleidomastoid muscle would be your anterior triangle, whereas anything behind would be your posterior triangle. Now, before going and talking about your side of the neck and the triangles, let's appreciate this diagram. um, front of the neck front of the neck, we can see we have the hyoid bone, we have the lesser horn, and we have the greater horn of the hyoid bone. Hyoid bone is at the level of C3. So here we can see C3 is cervical segment, C3 is spinal vertebra. So here we can see in the front of the neck, midline structures would be your hyoid bone with lesser horn with your greater horn. Then we have here we have your thyroid cartilage. Uh, this structure also gives its name the Adam's apple. This one, all right. And here we have the thyroid cartilage. Then here, of course, we have the membrane, hyothyroid membrane over here. Then we have this one over here. We have the cricoid cartilage. Then we have the thyroid gland. All right. So remember, many students confuse this, like they think thyroid gland is related to the thyroid cartilage. No, it's a difference. Thyroid gland is much more below. Yeah. Here's the isthmus of thyroid gland with two lateral lobes. Yeah, over here. Then we have the tracheal rings, very easily seen in this diagram. So this is the midline structures of the neck. Now let's talk about the triangles of the neck. Triangles of the neck, as I already mentioned, anterior one and the posterior one. Now here we have the anterior and posterior triangles have been divided with the help of this sternocleidomastoid muscle, tall broad muscle in the side of the neck, which can uh, which helps your neck to rotate sideways also. All right. And important clinical point would be when someone has a wry neck. Yeah, so in that case, the contraction of one muscle, it would make a person have the neck contracted on the moved on the other side, and it's very painful. So here we have the sternocleidomastoid muscle with the two heads. Here we can see one is your clavicular head, one is your this one is your clavicular head, this one is your sternal head. Here is your mastoid process over here. So this muscle, anything in front, this is your anterior border of your sternocleidomastoid muscle, and this is your posterior border of your sternocleidomastoid muscle. So in front, we have everything over here. We have this all area is anterior triangle, and behind the posterior border of the sternocleidomastoid muscle, we have the posterior triangle over here. Now, let's talk about the anterior triangle. Now, anterior triangle itself is divided into further four of them. Over here, we can appreciate we have the this one over here. We have the submental triangle. All right, this one is the submental triangle. Then over here we have the submandibular triangle. Then we have the carotid triangle over here, and here it would be your muscular triangle. All right, this one. Yeah, so this one is your muscular triangle over here. This one is your carotid triangle, and this one is your submandibular and submental. So anterior triangle is divided into four triangles. One is your submental, submandibular. This one muscular triangle in the midline, somewhere in the anterior neck, and in the side of the neck we have the carotid triangle. Posteriorly, we can see we have two triangles formed. One is above one, the superior one is your occipital triangle, and the below one is your supraclavicular triangle. All right, supraclavicular triangle over here, this one, and this one is your occipital triangle. Now occipital triangle and posterior triangle is divided into upper triangle and below triangle, lower triangle, or we can say posterior triangle is divided into two triangles. One is your occipital triangle, one is your supraclavicular triangle, through this muscle, omohyoid muscle. Yeah. Now this one is your omohyoid muscle. Here we, why omohyoid? Because here we have the hyoid bone over here. This is your superior belly of omohyoid, and this is your inferior belly of omohyoid muscle. Now this one omohyoid, why omo? Because it's going towards your shoulder area. That is your scapular area. So that's why omo from Greek, as we know, it is your shoulder area or your scapular area, and from therefore its origin is from shoulder area or from the scapula going towards hyoid bone. All right, so it has a tendon intermediate tendon behind. If we remove this SCM, sternocleidomastoid muscle, we can see these two bellies have a interconnection, that is your intertendon. Same just like your digastric muscle, as digastric muscles also has a intermediate tendon, which we will discuss. So a question can be asked: posterior triangle division. Posterior triangle is divided into two triangles with the help of what? With the help of which structure? So our answer should be it should be inferior belly of your omohyoid muscle. All right. So omohyoid muscle divides your posterior triangle into your superior one, that is your occipital triangle, and below one, the lower one, is your supraclavicular triangle. Here we can see supraclavicular triangle. Anterior triangle is divided into four structures. One is your submental triangle. Now, submental triangle, it's a unique, it's a single triangle. Yeah, rest are on both sides, but this one is one single one. So that's why anterior triangle, we can say, is divided into three and a half. All right, on each side. So this is only one triangle. So 1, 2, 3, and this will be 1. All right. So like this, overall anterior triangle is divided into three and a half. So submental triangle over here, then submandibular, carotid, and muscular. So now let's talk about in detail. Landmarks, as I already mentioned, here we have the SCM, sternocleidomastoid muscle, with with two heads. One is your clavicular head and one is your sternal head, and going upwards vertically and getting inserted into your mastoid process. This is your anterior triangle. So boundaries of anterior triangle would be your midline in the neck, anterior midline, your ramus, your inferior margin of your mandible, all right, and anterior border of your sternocleidomastoid. So these would be boundaries of anterior triangle itself. Then posterior triangle boundaries would be posterior margin, posterior border of your sternocleidomastoid muscle, your upper margin of your clavicle, and anterior border of your trapezius muscle. So here we have the trapezius muscle. All right. So this is overall the boundary of posterior triangle. Now, here we can see, now we can appreciate we have trapezius muscle over here. We have sternocleidomastoid. So anything behind the triangle behind the sternocleidomastoid muscle would be your posterior triangle. All right. So this is your posterior triangle. Here we can see the floor of the posterior triangle. All right. So this is the floor of the posterior triangle formed by these muscles in the back area. Yeah. Splenius capitis, the most superior one, and then the levator scapulae and the scalenus medius over here, forming the floor of your uh, posterior triangle. All right. Here we have the superior nuchal line, and we won't talk about the ligaments and everything. But question can be asked: what is the floor of the posterior triangle? Floor of the posterior triangle is formed by three main muscles. Of course, semi-splenius capitis, a very short muscle, can be also included. So four muscles we can say: semi-splenius, splenius capitis, levator scapulae, and splenius medius. Here forming the floor of your posterior triangle. Of course, if this is the floor, roof would be your investing layer of your deep fascia. Yeah, investing layer of deep fascia would be your floor. Boundaries of your posterior triangle would be posterior border of your sternocleidomastoid muscle and the anterior border of your trapezius muscle, and inferior border would be your clavicle. All right. Now here we have dissected the sternocleidomastoid muscle so that we can appreciate area below sternocleidomastoid muscle. All right. Anterior triangle, this area, and here would be your posterior triangle. Here we can see posterior triangle behind your sternocleidomastoid muscle, which has been dissected, so that we can appreciate the region below sternocleidomastoid. So area behind sternocleidomastoid posterior border would be a posterior triangle, which is divided by this posterior belly of your omohyoid muscle into your occipital triangle and your supraclavicular triangle over here. Yeah, very important structure. Area supraclavicular triangle, because all your brachial plexus, cervical brachial plexus, trunks and roots would be located in this area. All right, very important. Occipital artery, occipital triangle would have occipital artery. So basically, why these triangles are named occipital triangle, why it is called occipital triangle, and why it is called supraclavicular triangle. It is called occipital triangle because it's related to a artery, occipital artery, which is in this area. That's why this is called occipital triangle. Why supraclavicular triangle? Because we have a or subclavian triangle. We have subclavian triangle or supraclavicular triangle. Why it is called so? Because we have the subclavian artery. All right, subclavian vessels in this area. So that's why, according to the arteries, these areas have been named. Then let's talk about the anterior triangle. Anterior triangle. Here we have the hyoid bone. Here we have the chin. Yeah, symphysis menti, midline structure. So below, above your hyoid bone and below your chin area, it's your this one submental area. I'm sorry, this one submental area below your symphysis. Yeah, symphysis is your chin. Symphysis menti. Yeah, the midline structure of your chin is your this area, and here is your hyoid bone. This area would be your submental area. That is submental. That's why, because it's below your symphysis menti or below your chin. Yeah, so submental area. Submental triangle. Submental triangle has the important content of the submental triangle would be important. But important one would be your, you need to remember, is your anterior jugular vein. All right, anterior jugular vein. Here we have the submandibular triangle. Now boundaries of the submandibular triangle would be your anterior and posterior belly of digastric muscle. So anterior part would be your anterior digastric muscle. Posterior margin of the submandibular triangle will be your posterior digastric muscle. Inferior boundary, inferior apex of this triangle would be your intermediate tendon, that is between your digastric and the uh, posterior digastric anterior belly and posterior belly, where they join, they form your intermediate tendon, IMT. So that would be your apex. And upper boundary of your submandibular triangle would be your mandibular area. All right, um, mandibular bone and your muscles. All right, then what else is left? Then we have the carotid triangle. Carotid triangle is in this area like this. All right. Now, anterior triangle, as we know already, we have mentioned, anterior triangle is bounded by midline of the neck, inferior boundary of the mandible, anterior boundary of SCM. Yeah, very basics. Here we have the anterior triangle over here. This is your sternocleidomastoid anterior triangle as a whole. but further divided into submental area, submandibular area, this one carotid area, and this one your muscular area, muscular triangle. All right. Anterior triangle further divided into four triangles. Submandibular, also known as digastric, because of the digastric muscles of anterior belly and posterior belly. Submental area, yeah. And then we have the carotid and the muscular. This diagram again illustrating your posterior triangle and your anterior triangle. Anterior triangle is divided further into four triangles. Submental, below your chin. Submandible, because your submandibular triangle includes your submandibular gland. Carotid triangle includes your carotid triangle. Includes your internal carotid artery and other structures which we will talk about. Then the muscular area, which includes your strap muscles, yeah, infrahyoid muscles in the midline structure, midline area. Again, here we can appreciate anterior belly of digastric, posterior belly of digastric, getting in joined at the intermediate, forming an intermediate tendon over here. This one, therefore, forming submandibular gland. Here is your ramus. Here is your mandible. So, therefore, this one is your submandibular area. This one in the midline, in the below chin, we have your submental area, one triangle. Then here we have the carotid triangle. Now, carotid triangle again has important um, structures. That's why the name carotid vessels going through it. Therefore, common carotid, external jugular vein, external jugular artery, sorry, internal carotid artery, and your common carotid artery. So that's why carotid triangle. Then we have the muscular triangle, because we are talking about the muscles over here. Those are your infrahyoid muscles, all right, also known as strap muscles. Then posterior triangle, we have posterior triangles. The superior one, the bigger one, upper one is your occipital triangle. Why called occipital triangle? Because it has occipital artery going through it. That's why occipital triangle. Supraclavicular triangle or subclavian triangle. Why subclavian or supraclavicular triangle? Because we have the subclavian vessels, that is subclavian artery and vessels present in this area. All right. Other than that, we have your brachial plexus, roots and trunks of brachial plexus present in this area. Contents of the anterior triangle as a whole. Let's very quickly go through them. Now, as we know, anterior triangle is divided into four further triangles, but as a whole, that's what we can appreciate here. Of course, we will have in the submental area. In the submental area, we will have your lingual artery present. All right, and base of the your base of the your tongue would be present in the submental area. All right, your teeth would be present in the submental area. All right. Then in the submandibular area, we will have your facial vein, facial artery. Then we have your submandibular gland over here in this area. All right. Then we have your lingual artery present in this area. All right. Hypoglossal nerve would be present in this area. Then we have the carotid triangle. Somewhere here in the carotid triangle, we can appreciate we have the common carotid artery, internal carotid artery, all right, external jugular artery, external carotid artery, sorry. All right. Then we have your nerves present in this area. All right. Your cranial nerve 10th, your sympathetic chain, your ansa cervicalis, yeah, which would be anterior in the common carotid sheath, which we will further talk about in upcoming slides. Then we have over here, we will have your strap area, muscular area, which would be your having your strap muscles. All right. Now, let's talk about each triangle individually. Here we have the submental triangle. Submental triangle. Here we have myoid muscles over here forming the floor. All right, of this area. All right. Then we have the anterior digastric belly, which is forming the boundary, and here we have the hyoid bone. Hence your submental triangle. Submental triangle, of course, will have your submental nodes, lymph nodes present here, which is the part of your superficial lymph nodes. Remember, deep cervical lymph nodes are something else, and superficial cervical lymph nodes are something else. So this is part of your superficial lymph nodes over here present in the submental area. It will, of course, this area, of course, would have, therefore, is your tongue, your anterior jugular vein. Anterior jugular vein would be formed somewhere here and hence for draining down and eventually entering your external jugular vein and going to your subclavian vein. But your anterior jugular vein is somewhere is formed in this area, all right, and then it comes down, drains down, and somewhere in the supraesternal notch forms a goes bilaterally, all right. There's a connection between anterior jugular veins on both sides, all right. So submental triangle will have a content would be your anterior jugular vein. And here we can also see, here we have the anterior jugular vein formed in the submental area, submental region. Here is your hide bone going down, and anterior jugular vein is somewhere in the supraesternal notch joining. All right, and anterior jugular vein is this one. All right, so it's a submental triangle uh, has the initial part, the commencement of the anterior jugular vein starts in the submental area. All right. Let's talk about the submandibular triangle. Submandibular triangle, it would be in this area. All right. Here, let's talk about. So this is a submandibular triangle. Here we have the anterior belly of digastric, posterior belly of digastric, forming your anterior and posterior boundary of your submandibular triangle. Submandibular triangle, of course, as I already mentioned, anterior belly of digastric, posterior belly of digastric, inferior border of mandible and mylohyoid muscle will be your floor. So anterior belly, posterior belly, and your superior will be your uh, inferior ramus, inferior boundary of your mandible. All right, and all right. So this is a submandibular triangle over here. Submandibular triangle. The main structure over here present is your submandibular gland. Over here, submandibular gland. The floor of the submandibular triangle is formed by this mylohyoid muscle. Yeah, mylohyoid muscle over here, and mylohyoid muscle and plus your hypoglossal muscles. These are forming your floor of your submandibular triangle. All right, and it has an important structure that is your submandibular gland, along with um, of course we will have your facial vein, facial nerve, everything in this structure which we will talk about. Yeah, so boundaries are cleared. Boundaries should be cleared. Here let's talk about the content of the submandibular gland very quickly. Here we have the submandibular gland. Boundary of the submandibular gland would be, here is your inferior boundary, inferior border of your mandible over here. Then we have the superior belly of digastric, posterior belly of digastric, submandibular gland. Here we have facial artery, facial vein in this area. So everything, it is a part of your submandibular gland. So content of the submandibular gland would be your facial artery, facial vein, submandibular gland itself. All right. Here we can see, as we know, floor of the submandibular gland is formed by the mylohyoid muscle. Mylohyoid muscle over here. Insertion posteriorly is much more uh, below, much more superior in the posterior area. So that's why, as we can see, if the insertion of the mylohyoid is somewhere superior over here, so infection in the this, here we can see the molar tooth, the third molar tooth or the wisdom tooth. In fact, infection of this area can lead and come into this submandibular space. Yeah, submandibular space, and it can further go down and infect. So the infection from this molar tooth or the wisdom teeth infection, yeah, or abscess in this area can um, continue and come down even in the submandibular space. So that's why it is very important. Yeah, so molar tooth infection. The reason for the exam purposes, why is it? Because the mylohyoid muscle Anteriorly, it is much more anteriorly. It is in the mandibular, in the mandible. This is mandible, which is has been cut off so that we can see. So mylohyoid muscle anteriorly in the mandible, it's much more below, but posteriorly it goes above. Its insertion is very above posteriorly, superior. Its insertion is very superior posteriorly. So that's why. So infection can easily come from this, can spread. All right. So that's the reason I included this slide so that I can have an idea. Contents of the submandibular gland, as we already met, submandibular triangle, as already mentioned, facial artery, facial nerve, lingual artery, lingual nerve going towards your tongue. All right. Then we have the mandibular branch of the facial nerve and hypoglossal nerve, which we will see. Now, submandibular triangle, for the exam purposes, I would like to um tell the students submandibular triangle is further divided into lesser triangle, Pirogev's triangles, and the Backlash triangle. It is further divided, yeah. So um, here we can see this one. We have the triangle, which is the lesser triangle. So lesser triangle boundaries would be, it would be your anterior belly of the posterior anterior belly. All right. Then here we have the hypoglossal nerve. So hypoglossal nerve would form the superior boundary of the lesser triangle, hypoglossal nerve. All right. So this one is your, and posterior belly will form the posterior boundary of your this lesser triangle. So this area, this one, this all area is your lesser triangle. So lesser triangle boundary would be your digastric muscle, anterior belly, hypoglossal nerve, cranial nerve 12. Yeah, cranial nerve 12 would form the superior boundary. Posteriorly, it would be your posterior belly of digastric muscle. Your stylohyoid muscle. Sorry, stylohyoid muscle will form the posterior boundary. And here we can see this one over here is the intermediate tendon. All right, intermediate tendon. So boundary of the lesser triangle, for the exam purposes, it would be important. One is your anterior belly of your digastric. Then it would be stylohyoid muscle, you can say, but it won't be stylohyoid muscle. Of course, it should be digastric. This diagram doesn't show it correctly. So of course, it would be digastric muscle. Posterior belly, it would be, yeah, because it comes much more anterior. This one goes much more below. So of course, the boundary of the lesser triangle, as I already mentioned, it won't be stylohyoid. Of course, it would be digastric muscle, posterior belly, and superior belly. Superior boundary would be your uh, this one, hypoglossal nerve, yeah, cranial nerve 12. Importance of lesser triangle is, importance is related to your lingual nerve, yeah. So lingual nerve can be easily found in this area. Then we have Pirogov's triangle, also known as Pirogov's, yeah, triangle. This triangle is important because it's this triangle, the Pirogov's triangle, basically is a continuation of the lesser triangle, as we can see. Yeah, lesser triangle is just a continuation. Its boundaries would be your hypoglossal nerve, your posterior belly of uh, digastric muscle, you can say, and your intermediate tendon. So a Pirogov's triangle is itself is just a continuation of your lesser triangle. Just the important point is, of course, it will also have the your lingual nerve, lingual artery. Sorry. So importance of lesser triangle, Pirogov triangle is you have your lingual artery. Just important for the exam purposes is lingual triangle found in this area can be very easily used for microvascular anastomosis. Yeah. So if dissected and taken, so lingual artery taken from this area in the pyrograph's triangle is very easily found, and that part can be used for the microvascular anastomosis if taken. Then we have the Backlash Triangle. Now, in Backlash Triangle, it is in the posterior part. over here. Importance of the Backlash Triangle is cranial nerve 12. Yeah, hypoglossal nerve passes through it. Yeah, so you can easily identify hypoglossal nerve in Backlash Triangle. All right, Backlash Triangle, of course, boundaries would be your this one hyoid bone inferiorly, then your digastric muscle posterior belly superiorly, and the intermediate tendon over here anteriorly. Yeah. So importance of Backlash triangle would be your cranial nerve 12. Hypoglossal nerve passes through it, so it can be easily found. All right. So few specific points for all these three triangles. Yeah. Lesser, Pirogov's, Backlash, all three part of your submandibular triangle. Now let's talk about the carotid triangle. Carotid triangle over here, we have this one carotid triangle on the lateral part of the neck, lateral side of the neck. Boundaries would be, of course, anterior boundary of your sternocleidomastoid muscle. Below would be your superior belly of your omohyoid muscle. And in front, above it would be your uh, you can say uh, digastric posterior belly or your stylohyoid muscle. So carotid triangle, here we can see posterior belly, posterior belly of digastric muscle, superior belly of omohyoid, and anterior belly of SCM. So posterior belly of digastric muscle, posterior belly of omohyoid muscle, superior belly of omohyoid, sorry, and anterior border of your SCM. Sorry. Contents, of course, we will talk about these muscles individually. Here we can see carotid triangle. Carotid triangle, here boundaries would be your your posterior belly of digastric, your superior belly of your omohyoid, and your anterior border of your SCM. All right. Floor of the floor of the carotid triangle would be your four muscles. One would be your hyoglossus muscle. One would be your thyroid muscle, and two constrictors of your pharynx. One is your middle constrictor and inferior constrictors. I'm talking about the roof of the carotid triangle or any of the triangles, anterior triangle. Roof would be all the same, and the roof would be your investing layer of deep fascia, deep cervical fascia. Yeah. So investing layer would be covering all of them. So therefore, forming the roof of all these structures of all the triangles. Yeah. So that would be your investing layer of deep cervical fascia would be your roof. Floor would be formed by these four muscles: hyoglossus, thyroid, and middle and inferior constrictors of pharynx. Sorry. Sorry. So, talking about the contents, as I already mentioned, these are the boundaries: hyoglossus, thyroid, middle and inferior constrictor muscles of the pharynx holding the floor. Sorry. Now let's very quickly go through the contents of the carotid triangle. Now, carotid triangle would have ansa cervicalis. Ansa cervicalis, as we know, is a cervical plexus formed by C1, C2, C3, and a part of the hyoglossus cranial nerve 12. So, cranial nerve 12 gives the superior part, and the inferior one comes from this one, your C1, C2, and C3. This one is your inferior one. Then it goes towards the then this is your superior part of your ansa cervicalis. So ansa cervicalis, for the exam purposes, I have already mentioned in another video, is formed by C1, C2, C3, and hypoglossal nerve. Hypoglossal nerve just is helps these nerves to pass through it. That's the main purpose of the hypoglossal nerve. It basically doesn't innervate any of these infrastrap muscles. All right, infrahyoid muscles. So ansa cervicalis innervates your strap muscles, infrahyoid muscles. Just important pointers for the exam purposes. Remember your thyrohyoid muscle. Yeah, your thyrohyoid muscle is not innervated by ansa cervicalis. Rest all the inferior strap muscles are innervated by your ansa cervicalis. So ansa cervicalis is formed by your C1, C2, C3, and hypoglossal nerve. So it forms a kind of a ring like this, yeah, in the neck side of the neck, in front of the common carotid sheath. In front of the carotid sheath, it lies in front, in the neck, in the side area, in front of your carotid sheath. All right, and this role is to innervate your strap muscles. Here we can see strap muscles, that is your infrahyoid muscles. All right, and location of the ansa cervicalis is in front, anterior to the carotid sheath. All right. Contents of the carotid sheath. Here we can see we have the common carotid artery, we have the internal carotid artery. Here we have the external carotid artery, and external carotid artery, as we know, it gets divided into five branches. One is your superior thyroid, which is your first one. Then is your lingual artery. Then is your facial artery, and posterior one would be your ascending pharyngeal nerve, as ascending pharyngeal artery, and your occipital artery over here. Yeah, so occipital artery, and the terminal branches would be your, um, which is not shown over here, your STA, that is your superficial temporal artery, and your maxillary artery. Which, so terminal branches of your external carotid artery are not part of your uh, carotid triangle. So carotid triangle parts would be, this is the triangle, this is the carotid triangle. Let's talk about the contents very quickly. Common carotid artery, external carotid artery with its five branches, superior thyroid, lingual artery, facial artery, occipital artery, and your um, ascending laryngeal artery. All right, so we're here. Then internal carotid artery is a part of your external carotid triangle. Then we have the vagus nerve coming in between your common carotid and your internal jugular vein. And internal jugular vein would be your part of your common your carotid triangle, along with the lymph nodes. All right. And here we can see we have the hypoglossal nerve. If I'm correct, let's see. Yes, so this one is your hypoglossal cranial nerve 12, yeah, over here. So also a part of your carotid triangle. Sorry. Then we have another triangle itself inside the carotid triangle, part of our carotid triangle, which is your Farabeuf triangle. Yeah, boundaries of the Farabeuf triangle would be, here we have the hypoglossal nerve. This one is a common carotid triangle. Inside common carotid triangle, this small one, there's a triangle formed which is known as Farabeuf triangle. Boundaries of the Farabeuf triangle would be your cranial nerve 12, hypoglossal nerve, your common facial vein over here, anterior and inferior boundary would be your common facial vein, and posterior boundary of this Farabeuf triangle would be your internal jugular vein. All right. Importance of Farabeuf triangle is bifurcation of the common carotid artery basically takes place inside this triangle, or it's 2.5 centimeter below bifurcation, but it can lie uh, inside this Farabeuf triangle. So, if you want to locate common carotid artery, its main location would be in the Farabeuf triangle. Then the third um, triangle in the anterior triangle would be your muscular triangle. Muscular triangle is this one. Muscular triangle is in the midline structures, having a muscular triangle. Also, the name suggests it has muscles, which is known as the infrahyoid muscles. Why infrahyoid? Because it's below hyoid bone. And the triangle over here is formed by the Sternocleidomastoid muscles. All right, and here we have the inferior value of omohyoid muscle. All right, inferior boundary of omohyoid and the sternocleidomastoid muscle, and the midline is forming the strap muscles, forming the muscular triangle. So muscular triangle includes the infrahyoid muscles. All right, which are namely sternothyroid muscles. Then we have where else? Not shown in here. Then we have the sternum. It comes basically from hyoid to sternum, then from sternum to thyroid. Therefore, sternothyroid muscles. All right. Then we have the omohyoid muscles. These are the part of your infrathyroid muscles. Infrahyoid muscles, sorry. Boundaries I already mentioned. Contents would be again anterior jugular and inferior jugular, superior thyroid, same just like carotid triangle, which I will further talk about. Important point about the muscular triangle is muscles of the muscles of this muscular triangle would be infrahyoid muscles, not suprahyoid muscles. All right. So here we can see this is the muscular triangle with all the four strap muscles. Why strap? Because these are the strap muscles below your hyoid bones. Now, which are these muscles? Thyrohyoid. Why thyrohyoid? Because coming from your thyroid cartilage till your thyroid cartilage till your hyoid bone, a small muscle over here. Sternothyroid from your sternum till your hyoid muscle, a long muscle. Then we have sternohyoid, again from sternum till hyoid, longest one. All right. So, and these are the four main muscles, all right, of the is infrastrap muscles. Out of these all are supplied by your ansa cervicalis, which I already mentioned, C1, C2, C3. Out of these, thyrohyoid muscle is the one which is only supplied by your cranial nerve 12. All right, rest are supplied by your uh, by your ansa cervicalis. Then we have submental triangle. Submental triangle I already mentioned. It has content like submental lymph nodes, tongue, lower lip, incisors, teeth, yeah, and anterior jugular vein. Here is your submental triangle. All right. Floor and boundaries of the submental triangle. Here we can see we have the digastric muscle. All right, digastric muscle, hyoid bone. All right, and floor will be formed by mylohyoid muscle. Contents of the submental triangle. Here we can see commencement of your anterior jugular vein. Your anterior jugular vein arises in this area, submental area. All right. Here is the anterior jugular vein, a midline structure bilaterally, and further forming the supraesternal notch, forming a jugular venous arch. All right. Contents of the anterior triangle, other than all these, we have thyroid and parothyroid glands, submandibular gland, carotid sheath. All right. So here we can see hyoid bone. Hyoid bone. Here we have the strap muscles. Why strap muscles? Because these are pair of muscles which are infrahyoid. All right. So here we have the infrahyoid muscles, the thyrohyoid, omohyoid, sternohyoid, and sternothyroid. All right. All these three are supplied by ansa cervicalis. All right. Suprahyoid muscles. Why supra? Because they are above the hyoid bone and not part of your muscular triangle. So we won't read them. These are all the muscles, suprahyoid muscles. Infrahyoid consists of sternothyroid, sternohyoid, thyrohyoid, and omohyoid. Other than thyrohyoid, all rest three are supplied by your ansa cervicalis. Again, infrahyoid muscles, four of them, all right? Other than thyrohyoid, rest are supplied by your ansa cervicalis. Infrahyoid muscles, again, part of your muscular triangle. So this is your muscular triangle, including muscular triangle, therefore includes your these infrastrap muscles, these strap muscles, plus your trachea, esophagus, pharynx, larynx, all right, all part of your muscular triangle. Ansa cervicalis supplied, infrahyoid muscle are supplied by the ansa cervicalis, as I already mentioned, C1, C2, 3, which is a nerve loop on the internal jugular vein. All right. Blood vessels on the of the anterior triangle. So content of the anterior triangle would be your common carotid artery, as we already mentioned, common carotid artery on the bifurcates. A point to be remembered is it bifurcates at the level of C3 at the thyroid cartilage. Yeah, ECA and ICA, all right, into external carotid artery and internal carotid artery, and it's enclosed in carotid sheath. Internal carotid artery, um, of course, I have made another complete presentation on the internal carotid artery. It's inside the carotid sheath and is separated from external carotid artery by a styloid process, if we are talking about the cranial part, all right. And in the cervical area, it doesn't give no branches. Here we have the here we have the carotid sheath. Here we have the common carotid artery or internal carotid artery over here. Then we have the internal jugular vein laterally. So the question can be asked, which is the most lateral part of the common carotid artery? It's your internal jugular vein. The most posterior part would be your vagus nerve over here. Then outside, posteriorly to this common carotid, this carotid sheath, it would be your sympathetic chain bilaterally. Medially. And here in front, we have the ring, this loop of ansa cervicalis placed anteriorly in front of the common carotid sheath. Sorry, just carotid sheath. External carotid artery, as we know, gets bifurcated from common carotid artery. So these all these are part of your anterior triangle. All right. As already mentioned, here we can appreciate. Uh, This one over here is your, since it is a maxillary artery, this one is your superficial temporal artery. It can be easily palpated. If you, in front of the tragus, if you palpate this, you can feel the pulsation. You can feel the pulsation in front of the, if you put your index finger above your zygomatic arch in front of your tragus, you can easily palpate this superficial temporal artery. So that's why incision in this area should be made 1 centimeter in front of the tragus so that we don't uh, incise this. So, all right, superficial temporal artery STA. Then important artery because, of course, for the epidural hematoma, this can cause epidural hematoma also. All right. Then we have over here the maxillary artery. The maxillary artery and ST are the terminal branches of external jugular vein. All right. Other than that, external jugular vein gives 5 branches. Sorry. Um, so it would be a superior thyroid artery over here. This one, superior thyroid artery. Then is your lingual artery. Then is your facial artery. Then is your ascending pharyngeal artery. All right. And it's your occipital artery. So 5 branches. And you have your 2 terminal branches as well. So here is the branches of external carotid artery, superior thyroid artery, lingual, facial, occipital, posterior auricular, ascending pharyngeal, maxillary, and super STA are your terminal branches. Here easily we can see um, superior thyroid, lingual, facial, and then we have um, only posterior artery, posterior part of the cervical. In the cervical region is your ascending pharyngeal is the only one which is posterior. All right. Then we have posterior auricular and occipital artery. So easy to remember. These are the 2 terminal branches of your external jugular artery. Then internal jugular vein, as we know, um, it's a continuation of your sigmoid sinus in the jugular foramen, and in the carotid sheath, it lies in the lateral part. Here we can see the internal jugular vein. All right. Again, here we can see the right sigmoid sinus, right sigmoid sinus. Here we have the jugular bulb, and here we can see our right sigmoid sinus and internal jugular vein coming down. All right, and ultimately draining into, joining with your right subclavian vein and forming your um, brachio trunk of your brachiocephalic trunk in the right side. Then Here terminates by joining the subclavian vein to form the brachiocephalic vein in the right side. Here simple diagram, class 1 anatomy. Then here we have the right brachiocephalic vein, internal jugular vein, subclavian vein, combining and forming the right brachiocephalic vein. Here we can see, here we have your recurrent laryngeal nerves, sorry, part of your vagus nerve. On the right side, it's coming below your right brachiocephalic artery, below over here, but on the on the left side, your recurrent laryngeal nerve comes below the arch of the outer main point to remember. All right, recurrent laryngeal nerves, all right, part of the cranial nerve 10. Very important in the thyroid gland and thyroid operation and for the larynx. Yeah, so important structure which I will discuss in another video. Then cannulation of internal jugular vein. Internal jugular vein cannulation can be done through two approaches: high approach and low approach. In the high approach, what we do is vein can be palpated lateral to common carotid artery. Yeah, at the level of C6 vertebra, and whereas in the low approach, there's two heads of the common carotid. Sorry, this your internal jugular vein. It can be felt between two heads of your common your SCM, your Sternocleidomastoid muscle. All right. So here we can see we have the two approaches for the IG central cannulation catheter. If you want to place, here we can see this one is the upper high approach, this one is the low approach. Low approach is done very frequently because you can palpate two heads of the sternocleidomastoid muscle. One is your sternal head, all right. One is your clavicular head over here. Between that, between those two, all right, you can uh, insert and try to go for the cannulation for internal jugular vein cannulation. Yeah, here we can see internal jugular vein cannulation. All right. So this one would be low approach. This one would be high approach. All right. Somewhere, so you can palpate over here somewhere lateral to the common carotid artery over here. So here somewhere would be your high approach. Cedulous triangle, for the exam purposes, we must know cedulous triangle would be formed by sternocleidomastoid, clavicle, inferior border, all right. And so here it is your sternal head of sternocleido, yellow head. This one is your sternal head. Then here it would be your clavicular head, and the inferior border would be your clavicle. All right. So this is how the cedulous triangle is formed, and for insertion for internal jugular vein cannulation, you can go at the apex. All right, somewhere here. So this is the use of cedulous triangle to find out the internal jugular vein. All right, here it is the neck. Here is the clavicle. So clavicle is forming the base of this triangle. Now let's talk about the posterior triangle. Now posterior triangle. Here we can see. Here we have the posterior triangle. This one. Posterior triangle is divided into upper part, lower part with the help of this omohyoid inferior belly. This one is your occipital triangle upper part. This one is your subclavian triangle, occipital triangle, subclavian triangle. These are called occipital and subclavian accordingly respectively due to their arteries which are passing through these areas. Yeah. So in the occipital triangle, we are talking about the occipital artery, and in the subclavian triangle, basically we are talking about the subclavian artery. Now, boundaries of the subclavian of this posterior triangle, of course, I've already mentioned. Very easy to remember. Boundaries would be your posterior border of your sternocleidomastoid, anterior border of your trapezius, superior border of your clavicle. These are the boundaries, and the floor of this posterior triangle would be your these four muscles: Semispinalis capitis, plenis capitis, levator scapulae, and your scalenus medius would form the floor of this posterior triangle. Cutaneous branches in the posterior triangle, basically to be more precise, in the occipital triangle of the posterior triangle, occipital triangle of the posterior triangle would have four cutaneous branches. Here, these are, which I already mentioned in the beginning of this presentation. Here we have the four cutaneous branches in the occipital triangle: lesser occipital, greater auricle, transverse cervical, and your supraclavicular nerves. All right, and plus your internal jugular vein, as you can see. Roof, of course, roof of any of the triangles in the, whether it is anterior or whether it is posterior triangle, the roof would be formed with the investing layer of the deep cervical fascia. So occipital triangle, here it is the occipital triangle. Occipital triangle contents would be boundaries. I already mentioned boundaries would be same for all. All right. Just the difference is the inferior boundary of the occipital triangle would be superior border of omohyoid, and whereas superior border of subclavian triangle would be your inferior border of omohyoid. Omohyoid is the inferior belly of the omohyoid is the one which divides your posterior triangle into superior one and the inferior one. All right, which is your supraclavicular, sorry, your occipital triangle and your supraclavicular triangle, or also known as subclavian triangle. Supraclavicular occipital triangle, as I already mentioned, very important. It has four cutaneous nerve. The four cutaneous nerve would arise in the this area. This is also known as the nerve block area, cervical nerve block. Very important, very important area, because you can give anesthesia in this area and you can easily anesthetize these cutaneous branches. All right. So the location of these area would be here in the posterior border of midway in the occipital triangle, midway behind the posterior border of SCM, sternocleidomastoid muscle. Sorry. And the main important structure of the sternocleid of the occipital triangle is your SCN or SAN, yeah. So spinal accessory nerve. Spinal accessory nerve comes behind your sternocleidomastoid, pierces it, and go innervates your SCM, and then coming out in the posterior triangle, to be more precise, in the occipital triangle of the posterior triangle, and goes and further goes down and innervates your trapezius muscles. Yeah, so spinal accessory nerve is very important, and it is very superficial. So hence, if suppose you want to do, and because there are lymph nodes also present in this area, suppose you want to do a biopsy in the posterior triangle. So while doing if you want to do a biopsy in this area, so spinal accessory nerve is the one which is very frequently it can be injured. All right, so a care must be taken in this area while doing a lymph node biopsy. All right. And other structure, of course, as I already mentioned, it is called occipital triangle because of the occipital artery passing over here. All right, occipital artery, as I already mentioned, we have already discussed. It's a branch of your external jugular artery. All right, external carotid artery. Sorry. All right. Then four cutaneous branches we have already mentioned. I won't discuss them anymore. All the four cutaneous branches take place in the occipital triangle. Remember, main important structure of the spine is of the occipital triangle is your spinal accessory nerve. All right. Then below the inferior belly of omohyoid, we have the supraclavicular triangle or the subclavian triangle. Why subclavian triangle? Because we have the third part of your subclavian artery passing through it. Remember, the third part of the subclavian artery is passing through it, and we have the here we have the roots and trunks of the brachial plexus, which are passing in this area. So very important area. Remember, just the roots and trunks and branches of the nerves which are arriving from roots and trunks. Yeah, so there would be around four nerves which would be arriving from this area. All right. So of the brachial plexus. So those and subclavian artery, roots, Subclavian artery, subclavian vein. Yes, subclavian vein is the most anterior one. Here would be your ischial anterior muscle separating your subclavian artery with your subclavian artery, sorry, with your subclavian vein. These both are divided, separated by ischial anterior muscle. All right. So contents, if you really want to know, as I already mentioned, main one is your spinal accessory nerve. Here we can again appreciate a very, very good diagram of your posterior triangle, sternocleidomastoid, posterior border, trapezius anterior border, clavicle, clavicle superior border forming your posterior triangle. Here is your omohyoid muscle dividing your posterior triangle into your superior, that is your occipital triangle, and your inferior triangle, that is your supraclavicular triangle. Here we can see in the supraclavicular triangle, we have your subclavian artery, and we have your subclavian vein. Subclavian vein is situated much more anteriorly and separated by subclavian artery through your scalenus anterior muscle. All right. Then we have roots and trunks of your brachial plexus over here. So main structure of the subclavian artery is this one, and also you are not. I should mention we have lymph nodes present in this area. Yeah, lymph nodes. So also known as in the left side. If we talk about this one is the right side, but on the left side, if we talk about, we have the visceral nodes. Yeah. Um, all the metastasis from the abdominal area, from the mammary glands. All right. Uh, Neoplasm metastasis can easily pass into these supraclavicular lymph nodes, yeah, and therefore further going towards your brain or other structures, yeah. So from below abdominal region or the thoracic region, metastasis, that's why can pass into your brain and other structures in upper body through these supraclavicular lymph nodes. So very important lymph nodes in this is deep cervical area lymph nodes. All right. Contents of the posterior triangle already mentioned. Here we can see again same structure, four cutaneous branches over here, and your subclavian artery and subclavian vein in this is structures, and your trunks in this is trunks and roots of the brachial plexus present in the supraclavicular triangle. Occipital triangle, important part is your four cutaneous branches and your subclavian your spinal accessory nerve. Spinal accessory nerve can be easily seen, and your supraclavicular nerves, which I already mentioned in the beginning of the diagram. Supraclavicular triangle is divided into anterior division is the anterior division of the posterior cervical triangle, or the inferior division of the subclavian triangle. All right, and all the contents which I have already talked about: subclavian artery, subclavian vein, brachial plexus. All right, branches of cervical plexus, roots and trunks of brachial plexus. All right, spinal accessory nerves, subclavian artery, transverse cervical arteries. Sorry. So transverse subclavian artery, remember for the exam purposes, it is the third part. Transverse cervical artery. All right, coming from your subclavian artery is a trunk part, then external jugular vein. Lymph nodes would be your, as we know, lymph neck area is divided into different areas, subgroups. So it would contain occipital, your occipital lymph nodes area, and supraclavicular lymph nodes would be included in this triangle. Here we can see this one is the posterior triangle. So this one 5B, 5B would be your supraclavicular lymph nodes included in your supraclavicular triangle. Very important, very, very important lymph nodes, because these would metastasis into this would ultimately eventually lead to metastasis anywhere in the body. So especially when from the gastric cancer, if we are talking about, to be more precise. Again, same diagram showing all the structures for the occipital triangle and the supraclavicular triangle. I've already mentioned about all the four nerves, cutaneous nerves. Main one is superior, your spinal accessory nerve, all right, and your four cutaneous nerves. Here we have important structures. Most anterior one, subclavian vein, separated by subclavian artery through your your subscleneus anterior muscle. Then we have trunks and roots of your brachial plexus, and along the nerves of that area. Four cutaneous nerves in the occipital region, showing in that diagram. And brachial plexus, I won't go into detail because it will take another hour if we talk about, but the structures which are in the supraclavicular triangle, for the exam purposes, one must remember roots would be your C5, C6, all right, C7 also. So, two nerves which would be included would be your dorsal scapular nerve, which is the part of your C5, and this is coming from your root. And one is your long thoracic nerve, which has the innervation from your C5, C6, and C7. Yeah, long thoracic nerve. Now, long thoracic nerve is the one which is going to your serratus anterior muscle. Yeah, so helping in your winging of the scapula. Suppose if someone has the winging of the scapula, so in that case, if long thoracic nerve is injured, so patient can have winging of the scapula. Winging of the scapula can happen due to trapezius also, but long thoracic nerve serratus anterior can be caused due to injury to the LTN, long thoracic nerve. So two nerves which are arising from roots are dorsal scapular nerve and your long thoracic nerve. And so two from the roots and two from the trunks. So from the trunks, it would be your suprascapular nerve, all right, and nerve to subclavius. Yeah, suprascapular nerve and nerve to subclavius. Suprascapular nerves, remember for the exam purposes, it's a nerve which innervates both supraspinatus and infraspinatus muscle. So don't you confuse suprascapular just innervates supraspinatus muscle. No, suprascapular muscle nerve innervates both your supraspinatus and your infraspinatus. All right, spinatus muscles. That is muscle above the spine of the scapula and below the spine of the scapula are both innervated by the suprascapular nerves. So four nerves which are included in the supraclavicular triangle would be your two from your roots, that is your one dorsal scapular nerve and one your LTN, long thoracic nerve, and two nerves from your trunks. Yeah, here it is one your suprascapular nerve and one is your nerve to subclavius. And that's all. Hope you all understood a bit, and hope I hope it helps you in your upcoming exams. All right, thanks a lot. Have a good day. Bye bye.